Hello everyone, good afternoon. This is me Punambaral and this presentation is my new venture business plan for MediRich Mobile Care. The center idea behind this project is simply but powerful healthcare where you need it most. Over the past several weeks, I developed this business plan step by step, building a complete plan that includes market analysis, strategy, operation marketing, legal structure, and financial planning. Today, I will talk about through each of these components and explain how they will come together into on find healthcare solution designed for unserved communities. So let's begin. I started the project by identifying a major gap in the healthcare system. Many elderly individuals, low-income family members, and rural populations still facing significant barrier to accessing basic healthcare services. MediRich Mobile Care addresses this gap by delivering preventive and primary care directly to these communities through mobile medical units. The goal is to reach medically unserved areas, particularly in states like Texas, California, and Arizona. The service model includes primary care, chronic disease management, vaccination, screening, and telehealth support. What makes this idea strong is the combination of physical mobile clinics with digital healthcare tools, which allow care to reach patients both in person and virtually. The key takeaway from this stage is that healthcare becomes significantly more effective when it is delivered directly to patient instead of waiting for patient to travel to providers. Next, I developed the strategic direction of the business. The mission of Mediris is to deliver affordable, high-quality healthcare through mobile unit and telehealth system. The vision is to become a leading provider of mobile healthcare services across unserved communities in the United States. The core values focus on accessibility, compassion, innovation, integrity, and patient-centered care. One of the biggest strengths of this model is the high demand for accessible healthcare and the flexibility of mobile delivery system. However, the challenges include high start-off cost and managing different state healthcare regulations. To address this the strategy includes a 5-year phase expansion plan supported by partnership with regional health organizations. The key takeaways here is that a clear and structured strategy is essential for long-term sustainability and controlled growth. In this section, I focus on how the business creates and capture value. The value proposition is centered on bringing healthcare directly to communities that face access challenges. Key partnership includes hospital, non-profit organizations, insurers, and government programs. Revenue comes from multiple streams such as patient fees, Medicare and Medicaid, reimbursement, telehealth services, grant, and employer wellness programs. Financial projections show steady growth from 0.45 million in a year to about 1.9 million by year 5. The key takeaways in that diversification of revenue sources and strong participations are critical for financial stability and long-term scalability. Marketing and branding. For marketing, the focus is on building trust and accessibility. The brand position made it rich as convenient, affordable, and community-focused healthcare. The tagline, healthcare where you need it most, reflects this mission clearly. Marketing efforts includes community events, partnership, local media, and digital advertising. Word of mouth and referral system also plays an important role in reaching patients. In addition, AI tools support scheduling, communications, and route optimization. making operations more efficient while improving patient engagement. The key takeaways is that effective marketing in healthcare is not just about visibility, it is about trust, consistency, and community connection. Legal and ethical plan. This section focuses on compliance and ethical responsibility. Since healthcare involves sensitive data, HIPAA compliance is the top priority, including strong data encryption and privacy protection. The business also follows CMS regulations and state level healthcare laws to ensure proper billing and clinical operations. Intellectual property protection is secured through trademarks and priority systems. Ethically, the organization priorities patients' privacy, informed consent, and equal access to care. AI tools are used responsibly, always under human oversight to prevent error or biases. The key takeaways is that legal compliance and ethical leadership are essential for building trust and avoiding operational risks. Operation focus on delivering care efficiently through mobile medical vans equipped for vaccination, chronic care, and telehealth support. AI system help optimize routes, manage inventory, and schedule patient appointments. The organizational structure includes leadership roles such as CEO, medical director, and Department of Operations, finances, HR, technology, and supply chain. Continuous training and performance evaluation ensure quality service delivery. The key takeaways is that strong operations and a well-structured teams are essential for consistent and reliable healthcare delivery. For the financial plan requires about 1 million in startup funding to cover mobile clinics, equipment, staffing, technology, and marketing. The break even point is around 6,667 patient visits as per the projection by year 2, with revenue expected to grow to 1.9 million by year 5. Funds are allocated carefully across infrastructure, technology development, and working capital. Risk management strategies include diversifying revenue streams, maintaining reserves, and protecting against reimbursement changes and cybersecurity threats. The key takeaways is that financial sustainability depends on carefully planning, realistic assumption, and strong risk management. So, at last, the financial plan, in conclusion, MediRich Mobile Care is designed to address a critical healthcare access gap in unserved communities. The plan integrates a strong market needs, a scalable business model, effective operation, ethical practices, and sustainable financial structure. Moving forward, the next step includes expanding to additional state, improving healthcare capabilities, and building stronger partnership within communities. Overall, the vision remains clear to deliver quality healthcare where patients need it most. And these are the references that I use. Thank you so much.